This is the presentation made by me, myself, Anna, and our full member of Academy of Sciences and Arts, Professor Fedor Mesinger. This will be just lines drawn from our national documents regarding the current state of knowledge regarding health. So the main conclusions derived from such documents. First, a little introduction about current climate change condition in Serbia, which was the main basis for selecting those priorities I will show later in the health sector. Observed climate change is evident in Serbia. I mean, this is the list of the warmest years on record for the territory of Serbia. As you can see, the last, I don't know, 10, 11 years, they're all recent. I know that the last 7 or 8 years are all in the highest record 8 warmest years. We have a very, we had a lot of heat waves, droughts, floods, flash floods actually, and enough examples to draw some conclusions about different impacts of climate change. Climate value of temperature in average increased by 1.2 degrees in Serbia. Summer temperatures are warming faster by 1.8 degrees by now, and the fastest increases of maximum summer temperature over 2 degrees by far. These are the mean 20 years values, but for the last 10 years the values are actually, these are for the last 10 years, but for recent years, the values are even higher. Change of mean accumulated annual precipitation is not that evident, as is the summer decrease of precipitation, which is actually the cause for increased drought severity and intensity. We know that climate change impacts physical, mental, and emotional health of individuals and of the community. So we can divide climate change impacts on as direct and negative impacts on health and indirect impacts on health, and both are equally important considering climate change impacts, even though some impacts can come are priorities for other sectors. Direct negative impacts are from extreme events such as heat waves, floods, and fires, and also droughts. Indirect events, indirect impacts evident from records on frequency of vector and rodent-carried diseases, from impacts of disease of low drinking water quality, air quality, and food quality. These are just some of the indirect impacts of climate change on health, and also is noticed increased number of injuries, deaths, and infections that can be related, actually statistically correlate with climate change. Actually, what we also know is that vulnerability of health to climate change also depends on the severity of climate change and socioeconomic conditions of the community. These socioeconomic conditions of the community are currently the main driver for targeting the priority areas for implementation of health adaptation to climate change. What is also important thereby is to distinguish more vulnerable population and prioritize risks and measures for mitigation of those risks. These are just a list of documents considered here for this presentation. As I said, firstly, Another thing I forgot to say, I showed only observed changes, climate changes for Serbia. We also tossed and turned all ensemble future climate projections, downscaling of the future climate projections, and what is important, in relatively near future, next several decades, the trends which are observed will continue. So increasing what is already noticed. Identification of vulnerable population groups was the first step. For determination of possible adaptation measures. And these are population groups vulnerable to climate change in Serbia, older population, which is increasing. 20% of the population is over 65 years of age. Also, there is aging of households, which is also a problem because they are living alone. It is high risk of poverty, and so on. Then poor population, of course, because they are mostly outside urban areas, especially in eastern Serbia. Then 500,000 people actually can be considered as poor population in Serbia. They cannot sustain on their incomes. Rural population, they're exposed to climate change very much because of the nature of their jobs. They are usually in poor living conditions, low accessibility to healthcare, which is the main problem here. Low incomes and unfavorable age structure. Also, many of them are within the older population group. Outdoor physical workers is also important population group vulnerable to climate change. Includes almost 3 million people in Serbia. They have high exposure to climate change impacts, inappropriate health care. They work in extreme conditions, also during the extreme weather. They have inappropriate equipment for protection, and also unfavorable age structure. Also, our aging population, believing or not, physical workers are older and older. And especially vulnerable group, which are children, prematurely born infants, people with chronic illnesses, and so on. So taking data from all these population groups, we can assess that in Serbia there is about 2.5 million people vulnerable to climate change. Their health is vulnerable to climate change, and which is about 35% of the total population. And another conclusion is they are more represented, these vulnerable groups, in South and Eastern Serbia. Next thing is to identify climate change indicators related to health risks. So we can do a health risk assessment for population groups impacted by climate change in Serbia. Climate change indicators are identified, and they are expected to relate directly or indirectly with health risks. Climate change indicators which are selected to assess impacts to health are heat waves, extreme precipitation and floods, and as a consequence of extreme precipitation and increased excess of water, wildfires, drought, and temperature increase in general, and other future climate change impacts are in one bucket all. Maybe in the future will be done, these assessments will be done for other things in more details. Heat waves and using some systematic analysis of weather conditions, extreme weather conditions, or these indicators which are listed, and records from hospitals, for example, of increased injuries or hospitalized persons with chronic illnesses, also infected people infected with some diseases was like West Nile disease and so on, brought us to some conclusions that these are health effects that can be related to these climate change indicators. Premature deaths, heat exhaustion strokes, heat strokes with heat waves. Actually, there is some assessment which is shocking. When temperatures exceed 90th percentile, the mortality is of people with chronic illnesses is increasing over 20, and with record values, near record values of temperature by over 30%. Comparing to relatively normal conditions. So it is a huge impact of heat waves. Extreme precipitation floods cause much more injuries, drowning, unfortunately, and more infections and diseases, and reducing fresh water quality. Wildfires, which are actually the consequence of dry conditions and very high temperatures, cause deaths from suffocation, injuries, a decrease of air quality, water quality, decrease of environmental conditions, and so on. Drought damage the food supply, cause water shortages and malnutrition, and increase of diseases. Then other impacts of climate change caused the appearance of new diseases. For example, West Nile disease was found somewhere a little bit before 2010, 10 years ago, and now it's almost a common thing to find the mosquitoes infected carrying this disease, and number of people hospitalized because of this are increasing. This is just one example, and actually monitoring of this kind of mosquitoes is one of the biodiversity indicators related to climate change monitoring. So spreading of diseases is faster. There is shortage of drinking water supplies and water for irrigation. There is more allergies. And so on and so on. High risk, of course, for chronically ill. We tend to expand this list of indicators to create new indicators better related with health. We just need more studies that will show us the future path of monitoring of health issues related to impacts of climate change. Next step is identification of climate change adaptation measures for reduction of health risks. There are some adaptation measures proposed with dedicated adaptation targets. So this is an initial list. What is the you must realize that adaptation to climate change in our health sector is still not well analyzed, of course. There is no assessment on significance and urgency of measures. One of the main conclusions is that adaptation measures can be focused to increase the resilience of population or individuals, to work on that, and that will produce adaptation to climate change to reduce health risks. Then building increasing infrastructure capacities like hospitals or I don't know, response to emergency calls in remote areas and so on. Adaptation targets selected is increased preparedness on extreme weather, and correlated adaptation measures are to educate people, disseminate better warnings and information, which is the hardest part, increase ambulance capacities and preparedness. Then second adaptation target is protect communities from extreme events, meaning adapt infrastructure to sustain new predicted extremes, meaning that these weather extremes will push much beyond observed ones. So infrastructure should sustain these strong hits of weather. Then increase readiness of responsible institutions for emergency situations. readiness is the crucial thing. So it could mitigate actually these increased health problems. Then monitor diseases, also important thing. So we can widen the list of the diseases or newborn diseases, and also the periods with increased infections from these diseases. Educate health workers and veterinarians to recognize and record diseases, and to learn relations with those appearances of those diseases with weather conditions. Then monitor food and water quality, increase the adaptation measures increase efficiency of this monitoring system during and after extreme events, and keep records and again, keeping records and learn relations, actually perform some studies of these records, recorded data with weather conditions. So we can apply them on future simulations and learn how things will go in the future to know better quantitatively and not just qualitatively. Then prevent diseases spreading or act in early stages, increase disinformation again about spreading of diseases, recognize diseases in early stages, increase healthcare capacity is the crucial thing, better access to healthcare to vulnerable population. This is, I think, one of the priority things, and protect outdoor workers, renew or introduce new standards with criteria for health risks under the extreme events. So it's time not to rely on the old standards, which would, I don't know, protect workers working outside on under the extreme weather, but renew those regulations and protect the workers from the injuries and from maybe some long-term impact on their health. So these are most important things, and strengthen control of the working environments of those workers. Some initial priority adaptation measures, the deep impact reduction of healthcare risks, are included in the nationally determined contributions of Republic of Serbia. In the first slide,
May I ask to wrap up, please, for the, because it's we are running out of time for the presentations. If you could please finish in about 3-4 minutes, that would be perfect.
No, I will finish in just this is the last slide. I will finish.
Oh, excellent, excellent.
Okay.
Sorry for interrupting.
Okay. In nationally determined contribution of the Republic of Serbia, we have recognized health sector as one of the priority sectors for adaptation to climate change. And now we are working on the revised NDC with the goals up to 2030. It is also currently in draft version, but some priority measures are given related to health sector and indirectly related to public health sector. Measures which for which adaptation of public health sector is the main target is development of action plans in urban areas for responding to climate change impacts, introduce monitoring of diseases, West Nile, I don't know how to pronounce this one, and monitoring of vectors or insects, actually the insects for their transmission. Improvement and also important measure included in NDC is improvement of related scientific research, meaning more research, invest in more research on climate change and health relations, and with included interdisciplinary approach. Then other measures which are included in our NDC that also correspond and can impact adaptation of public health sector is improving protection of water quality, which is under water sector, but also contributes to public health, because it will, we said that water quality reduction happens during the extreme weather events. Development of flood risk management plans, improving protection against floods, improving the water management in dry conditions during the drought and water shortages, developing a system for risk reduction and assessment and monitoring losses and damages because of the natural hazards. Improvement of this is my favorite, actually, improvement of monitoring, forecast, and early warning hydrometeorological systems, meaning that early warnings or long-term warnings are possible to introduce and disseminate among the whole population. And integration of climate change projections is also important into national and other risk assessment, and probably the future health strategy must include climate information. This is all. Thank you for your time.